Social workers.
Did I understand that you're having another job?
No job.
Tell me about it.
Through direct counseling and consultation, social workers help their clients identify their various concerns, consider solutions, and find resources.
Primarily, I meet with people, and I try to figure out the things that they need and try to find the services that would help them meet those needs.
They help people with a wide range of problems, including mental illness, serious physical illness or disability, substance abuse, developmental disability, and serious family conflicts.
I work with people who are developmentally disabled. I had a brother who was developmentally disabled. That got me into, when I was in college, I worked at a summer camp for children and adults who were mentally retarded. And that got me interested in that, and then I got a job after I finished my master's degree in social work. I got a job at a social service agency working with people who were developmentally disabled.
Some of the resources social workers provide information about include where to go for debt counseling, finding child or elder care, applying for public assistance or other benefits, or how to be admitted into a drug rehabilitation program. They may review eligibility requirements, fill out forms and applications, arrange for services to be provided, visit clients on a regular basis, and provide support during crises.
It involves a fair amount of paperwork because we get funding from different sources, federal government, state government, and we need to document things for them. Also, if there's anything vocational, we help people make the connections. I call other agencies to see if they can serve this individual.
Most social workers specialize in a clinical field, such as child welfare or family services, health care, schools, criminal justice, occupational, or gerontological services. They also focus on policy and planning and help develop programs that address such issues as child abuse, homelessness, poverty, and violence. They may be involved in fundraising or writing grants to support these programs. They identify social problems and suggest legislative and other solutions.
Social workers can work in a variety of places. They can work in the Department of Social Services, wherever they live, primarily doing child protection or maybe adult protective services. They can work in psychiatric hospitals. They can be psychiatric social workers. They can work in nursing homes working with geriatric population. They can work in group homes. They can work just in a variety of agencies. There are specialized agencies like that work with people who are developmentally disabled. And also some social workers go on and get licensed to be able to do private practice.
A bachelor's degree in social work, BSW, is the minimum requirement for most positions. A master's degree in social work, MSW, is generally necessary for positions in health and mental health settings. Supervisory, administrative, and staff training positions require at least an MSW.
A bachelor's degree is necessary, and people who get bachelor's degrees can have enough of a basic education to be able to start somewhere at the lower levels. But a master's degree tends to be something that is very important. If you really want to get ahead, if you want to be licensed, if you want to work in a department where you're really actually doing social work, working with people heavily, you probably need a master's degree.
Doctorates are necessary for university teaching positions and most research appointments.
Hello, Bob. How are you doing?
Some social workers go into private practice. Most of these are clinical social workers who provide psychotherapy, which is usually paid for through clients' health insurance. These therapists must have an MSW and a period of supervised work experience.
Could we look at the Jane Smith file?
A network of contacts for referrals is also essential. All states have licensing, certification, or registration laws for social workers. Standards for licensing vary by state. Credentials are particularly important for those in private practice because many insurance providers require them for reimbursement.
Okay, so you're using your computer?
Social workers should be emotionally mature, objective, and sensitive to people and their problems.
It's very helpful if they're good listeners, if they're interested in listening to people talk to them, and if they can hear what people have to say. I would tell them that it would be helpful if they had a fair amount of patience and a fair amount of allowing people to do what they want to do as opposed to wanting people to do what we want them to do.
They must be able to handle responsibility, work independently, and maintain good working relationships with clients and coworkers. Typical job duties might include counseling a client who is developmentally disabled, offering psychotherapy at a mental health clinic, acting as advocate to the courts for an abused child, and coordinating the adoption of an infant. Earnings can range between $19,000 and $45,000 per year, depending on levels of education, credentials, and work experience. The necessary education and training includes a bachelor's degree in social work. A master's degree in social work is required for many positions. The completion of various state licensing, certification, or registration requirements is required, as well as obtaining the necessary credentials from the National Association of Social Workers. The job outlook is very good, particularly in hospitals, government, home health care services, schools, and private practice. Competition for jobs is higher in cities that have social work training programs. The best opportunities will be in smaller towns or rural areas. For additional information, write to the National Association of Social Workers, IC Career Information, 750 First Street, Northeast, Suite 700, Washington, D.C., 20002.